People have been warning about the problems with the federal government getting more and more involved with medical decisions. Well, today I want to ponder some of the examples of medical malpractice coming from the federal government and some of our state governments as well. So we'll do that next on the Constitution Study.
There's one thing you have to know wherever you make your stand. Came from a long through line of everyday Americans.
Hello there, everyday Americans. Paul Engel here with the Constitution Study, where we read and study the Constitution. We teach the rising generation to be free. I am glad you could join me. As always, I'm going to point you to that website, constitutionstudy.com, that you can find everything I'm working on. I've got some new things in the works. I am trying to get out more and more and meet people face to face. I was up in North Dakota last weekend, had a wonderful time at the Midwest Freedom Fest, met a lot of great people, heard some really good stories, and hope to share more of that with you. I hope for the opportunity to meet you as well. So if you have an event you think I might be interested in participating in or just attending, please head to the website, go to contact me, hit the speaking engagements, let me know that you might be interested. We'll do whatever we can to make that happen. I am setting up some webinars as well, so keep an eye on that. In fact, the best way to know what's coming down the pike is to sign up for the newsletter. You click the newsletter button, give me your email address and your name. I send you once a month what's on my agenda, what big articles have I worked on, what events am I involved with, once a month. Of course, you could also check the box that says have these messages delivered directly to your inbox. Don't worry about Facebook. Don't worry about Google. Have me go directly to you. All that's available on the website. And with that, let's talk about what I call COVID malpractice. I'm frequently asked about the constitutionality of masks and other mandates. So I thought I'd do an episode on that. As I started putting together my notes, several people approached me with other medical decisions being made based on medical information from the federal government, which I can only describe as malpractice. So let's take a look at some of them. In fact, let's start at the beginning, mask mandates. All right, public mask mandates are illegal. Now, there are a lot of people out there saying, well, it's part of the police power of the state and all that. Time. They are illegal, and it's really simple. You see, the Fifth Amendment says no person shall be deprived of life, liberty, or property without due process of law. And the 14th Amendment says no state shall make or enforce any law which shall abridge the privileges or immunities of a citizen of the United States, nor shall any state deprive any person of life, liberty, or property without due process of law. Now, obviously, a lot of this falls down into what is liberty. Well, if you go to Webster's 1828 dictionary, there's a long definition of liberty, but it sums up with civil liberty is the liberty of men in a state of society or natural liberty so far only abridged and restrained as is necessary and expedient for the safety and interests of the society, state, or nation. In other words, when we're talking about civil liberty, not general liberty or natural liberty, civil liberty means we can live our lives however we want. Restrictions on us are only based on the natural laws, the things like don't hurt people, don't take their stuff, and only positive laws, only laws of government that are necessary and expedient for the safety and interests of society. So the real question is, well, who decides what is necessary and expedient? Now, this all becomes important because the supreme law of the land is the Constitution. In fact, Article 6, Clause 2 reads, "This Constitution and the laws of the United States which shall be made in pursuance thereof, and all treaties made or which shall be made under the authority of the United States, shall be the supreme law of the land, and the judges in every state shall be bound thereby, anything in the Constitution or laws of any state to the contrary notwithstanding." So that means that any state law, even a state constitution, that would violate the Constitution of the United States is void. So there's no situation where the government has the right to infringe on your liberty without due process. Due process is defined as a process, legal or governmental, that protects the rights of the individual. Right? So there has to be a process that protects your individual rights. And the simple idea of treating you like Typhoid Mary simply because people are afraid, well, there's part of the problem. See, part of my issue with mask mandates is they assume everyone is guilty. You're guilty until proven innocent. You're guilty of being a contagion until you can prove your innocence. And in fact, there's never even an opportunity to prove your innocence. Now understand, I'm not against masks. There are situations where masks are useful. For example, I flew on an airplane. I'm in an airplane with a bunch of other people, close contact. Okay, masks might not be a half bad idea. Of course, those cloth masks don't work all that well, but we'll talk a little more about that later. But the general idea that you cannot be deprived of your liberty without due process is fundamental to a free country. The state cannot say, we are going to force you to do something unless they've gone through a process that protects your rights. So when I see people walking around in masks, I think two things. One is I realize most of them are following a government edict. They're servants. They're slaves. They are ruled by a government. The other is maybe they're just afraid. But again, we'll talk a little bit more later. So if the government, if these orders, if these mandates are illegal because they violate the Constitution, why do they keep getting enforced? Well, because we, the people, never stand up. We sit back and let police issue us citations, in some cases even arrest us. We never argue or debate. We never stand up and say, I'm sorry, you are violating the Constitution of the United States, and that is a criminal offense. I met with a lady this weekend who has a wrongful death suit against a state agency. I asked her if there were criminal charges filed because someone was wrongfully killed. That sounds like murder to me. Never did. Now, maybe she will. I hope I put the bug in her here, and maybe she'll consider that. But we have to start standing up and say, no, no, no. We are the sovereigns over government. You do not get to deprive us of our rights without due process of law. Now, if we're talking about masks, the question always comes up, well, what about private businesses? Can Walmart, Kroger, whatever, can they require you to wear a mask when you show up? Put another way, what do I do when I walk up to a store and they require that I wear a mask? Well, private businesses are just that. They're private. That's their property. They can do with it whatever they want. Now, the government has gone around and said, well, if you are open to the public, that is a canard. That is subterfuge. You do not lose ownership of your business simply because you open it to the public. As is frequently the case, that came from a desire to impose on people that they do business a certain way because we didn't like the way they did things. It started with black codes, forcing not only governments to get rid of discriminatory practices, but forcing businesses to as well. And are we really surprised that once we give the government the authority to tell some businesses how to do business, they don't simply tell everybody how to do business? But I was asked an interesting question the other day, and that was, what about corporations? You know, why do we keep treating corporations like they're people? So let me give you an example. Let's say you and I, we start a business. We're going to build widgets. Now, we go to a lawyer, we go to an accountant, they said, you know, there's really a lot of advantages if you incorporate. We talk about it, we decide, okay, we'll incorporate. We fill out the paperwork, and we create this new entity, this corporation for our business, Widgets Inc. Now, a corporation is a legal and tax entity. You're right, it's not a person. But let me ask you, when you and I incorporate our business, does that mean we don't own it anymore? Does it? Let's say our business does really, really well. We start to expand. We decide we're going to sell shares in Widgets Inc. So we have more and more people that are owners. Does that mean that they no longer own their businesses? If we've got thousands and maybe hundreds of thousands of people who own parts of Widgets Inc., do they no longer have a stake? Do they no longer have an ownership in their property? See, when you think about Walmart or Kroger or Target or Amazon or Starbucks, we think of them as some nebulous thing, but we forget they are owned by people. That's why we call them private organizations. They're owned by private individuals. And they have just as much a right to control their property, that business, as you have to control your home or your car or your iPhone. So when you go to a business and that says, we must wear a mask to, you must wear a mask to go in, that is them establishing the conditions under which you may enter their property. They have every right to do so. It then becomes a question of, well, what's more important to you? Your stand on your mask or doing business with them. Sometimes I wear a mask. I go to a business and funny enough, they say masks are required, and about 80-90% of the time I walk in without a mask and nobody says a word. But on the situations where they do say, yes, we want you to wear a mask, you're a private business, I had to make the decision, was flying to North Dakota more important than the inconvenience of wearing a mask on the flight? I wore the mask. Now, where this gets interesting is something that just happened recently. You see, an associate of mine got a letter from medical associates to school board presidents. He is a school board president. And it said that schools should follow the CDC guidelines. And he asked me to review this letter. Now, in this letter, they said, yes, school's going to be starting and you should follow the CDC guidelines. And they gave two examples, two studies about how wearing masks are good. One came from the Journal of the American Medical Association, or JAMA. And it said, quote, concluded that adherence to universal masking policies reduced SARS coronavirus 2 transmission within a Boston hospital. The second was a CDC report showing that, quote, showed that wearing a face covering prevented the spread of infection from two hairstylists to their customers in Missouri. Okay, let's back up a little bit. Based on my basic fact that I don't trust what most people say, especially government. Remember, the CDC is a government agency. The Centers for Disease Control and Prevention is not a private entity, it is a public one. It is owned, it is part of the federal government. So I did a little research. I actually found the article and the actual information about the study, and the authors presented data that, prior to the implementation of universal masking in late March 2020, new infections among healthcare workers with direct or indirect patient contact increased from 0% to 21.3%, right? An average increase of 1.16% per day. All right, now stop and think about that for a second. We go from January, where we're just not where everyone's actually focused on impeachment rather than on COVID. So between, say, December, January, February, and early March, when COVID is really starting to ramp up, guess what? They see an increase in people, healthcare workers with direct contact to patients having exposure. That's not exactly a surprise, right? However, after the universal masking policy was put in place, again, late March, the proportion of symptomatic healthcare workers with positive test results steadily declined from 14.7 to 11.5%. Okay, so we have the beginning of the pandemic, the scaredemic, whatever you want to call it. And yes, the numbers of infection rate goes up. And they said, oh, okay, we start wearing masks, and it comes down a little bit. However, there's really one really important piece of information that comes directly from this study that the CDC doesn't tell you. Quote, although not a randomized clinical trial, this study provides critically important data to emphasize that masking helps prevent transmission of SARS-CoV-2. Really? Does it? I'm sorry, there is not enough data to say that just because the number backed off in late March, it coincided with increased use of masks, but is it really the only thing that did that? Was it the mask that changed it? And oh, by the way, we're dealing with a hospital. They aren't using the face diapers everyone's wearing nowadays that's just made out of cloth. They're using surgical masks. Surgical masks are a lot stricter. They have a lot smaller pore than cloth masks. So even this data, they say not a randomized clinical trial. This is anecdotal. They saw a correlation. They assumed causation. So there's nothing in this quote-unquote study that proves universal masking actually reduces the transmission of COVID-19. It implies it might be part of it. It does not take into account the type of mask. It does not take into account other situations. You're in a hospital with people who are trained to deal with viral agents and contagions. That's a lot different than putting cloth face coverings on everybody in the country. Now, looking at the CDC report about the hairstylists in Missouri, right? From that report, among 139 clients exposed to 2 symptomatic hairstylists with confirmed COVID-19 while both the stylist and the client wore a face mask, no symptomatic secondary cases were reported among 67 clients tested for SARS-CoV-2. All test results were negative. Adherence to the community's and company's face covering policy likely mitigated the spread of SARS-CoV-2. By the way, coronavirus 2 is apparently the scientific name for COVID-19, or it's the precursor. I'm not a doctor. But what do we see? We see an extremely small sample size. We have 2 known infected patients. We have a relatively short period of time, because I don't know how long it takes 2 hair care stylists to see 67 clients. And they found no proof that there was transmission. Do you know what they don't look at? What were the other factors? Again, this is not a rigorous study. This is anecdotal evidence that correlation equals causation, which anybody who's done any logic knows that's not true. Yes, these 2 hairstylists were tested positive. They wore masks. Their clients tested negative. What else could have caused it? See, there's a correlation, but there's not a causation. Do you see why I call this malpractice? That's like going in and saying, well, you know, every time I eat at Taco Bell, I get an upset stomach, therefore, Taco Bell is food poisoning. Okay, there's a lot of other things that could be involving your tummy. There's a difference between correlation and causation that's being ignored by these studies. Now, in doing some research about the effectiveness of masks, I came across several references to a meta-analysis of 172 studies about the use of masks. And in their own findings, they write, quote, "Our search identified 172 observational studies across 16 countries and 6 continents with no randomized control trials and 44 relevant comparative studies in healthcare and non-healthcare settings. Transmission was lower with physical distancing of 1 meter or more." Continuing, "Face masks could result in a large reduction in the risk of infection, but with a low certainty. There's stronger association with N95 or similar respirators compared with disposable surgical masks or similar." In other words, this study says, well, there could be a reduction in the risk of infection, but they're not really certain. There's a low certainty. The percentage of likelihood is low. In other words, it's not something you'd bet the farm on. What they do say is there does seem to be a stronger association with N95 masks and respirators compared to, say, a surgical mask. Later in their interpretation, we read, "The findings of this systematic review and meta-analysis support physical distancing of 1 meter or more and provide quantitative estimates for models and contact tracing to inform policy. Optimum use of face masks, respirators, and eye protection in public and healthcare settings should be informed by these findings and contextual factors. Robust randomized trials are needed to better inform the evidence of these interventions, but this systematic appraisal of currently best available evidence might inform interim guidance." In other words, it says, you know what, it looks like social distancing, 1 meter, 6 feet, that appears to work in reducing transmission. However, there's not such good information about face coverings. They need more robust testing. But do we hear that? No. And in fact, anybody who questions the use of masks is often derided, called names, for simply saying, wait a second, the testing isn't there. Before you make me put a face mask, a diaper on my face, how about you come up with some real evidence that it'll do anything? You see, originally, I was thinking about talking about the moral issues, about what it means when a country starts wearing masks all the time. Not simply the isolation, which I find interesting because isolation is considered a form of punishment in prison. Yet we're being pushed to isolate ourselves every day. And we're seeing drug overdoses rise, we're seeing suicides rise, and that seems to be okay, so we protect ourselves from this virus? Think about what it means to walk around with a mask. See, when I was a kid, it was the bad guys that wore a mask because they didn't want to be recognized. To me, these masks are ridiculous. Okay, yeah, maybe if I'm sneezing or I'm coughing, it will catch some of the spittle coming out of my mouth. But doesn't it also mean that if that mask may become infected with something, I'm more likely to breathe it in? And is it really the role of government to tell me I must do something to protect you? Now, I'm not saying there aren't situations where it's morally right to wear a mask. I have an older father and an older stepmother, and if I visit them, by the way, I'm not wearing a cloth mask. I'm going to get a surgical mask. I'm going to get something that might actually work. If I go to visit someone who has an immune disorder or a respiratory disorder, I'm going to stay away from them, but if I have to go visit them, I'm going to wear a mask because I have a moral duty to care for my fellow man. But that's a lot different from the federal government and the state government saying, you must be treated as guilty until proven innocent, especially when they're doing it on fraudulent representation of these studies. So to my friend who got the letter from for the school board saying, by the way, make your kids all wear masks. Everyone from 2 years old and up should wear a mask, even though studies show that children are extremely safe. In fact, I have yet to find a study that found children ever transmit the disease. But we're going to turn them into little bandits because we're afraid they might do something to somebody else. This is an irrational reaction to the fear promulgated by the media and by our governments, and we're spreading it like its own disease. COVID-19 is not doing this to us. It is our own fear. Rather than taking rational, reasonable, scientifically proven steps to help protect yourself from a disease, we are turning the American society into a prison ward where you will walk around in chains, if not physical chains, social chains, legal chains. You will abide by this or you will be arrested. Now, if you are afraid of getting COVID-19 and you want to wear a mask and a face shield, be my guest. I have no problem with that. That's a decision you're making to protect yourself. But you do not have any more of a right to tell me I must wear a mask and face shield than I have to reach into your pocket and grab $20. Let's get away from feeding on the polluted refuse that's coming out of the CDC, the WHO, and the media. Let's take a little bit of time. The research I did to prove these studies were garbage took me a grand total of 15 minutes on the internet. 15 minutes. Let's stop trusting other people to tell us what we should think. Let's figure it out for ourselves. If we want America to be the land of the free and the home of the brave, we must start acting like free people. And we must be brave enough to take on for ourselves a basic understanding of what is going on. Otherwise, we are no longer a free people. We are serfs. We are slaves. And this is never going to end. Because now that the government knows they can boss us around, they can make you wear masks, they can make you shut down, they will shut down your businesses, they can make you act like everyone's a typhoid carrier. They're going to make you get vaccines. They're going to make you do a lot more things. Once they've learned they can get the American people, they can scare them into doing whatever they want, they will scare you into doing more and more and more that you don't want to do because you're afraid of what your government is going to do to you. As was attributed to Thomas Jefferson, but I found no proof for it, when the people fear government, there is tyranny. When the government fears the people, then there's liberty. So head over to that website, constitutionstudy.com. Let me know what you think. Hopefully you got some decent information. Hopefully I encouraged you to not trust what I've told you, to go out and find out for yourself, to think, to reason, to analyze, to look for help, look for information, but to think for yourself. And I hope it was worth your time, and you'll come back here the next time for for the Constitution Study.
There's one thing you have to know wherever you make your stand. Came from